A critical new effort has been announced to help keep students with disabilities safe in school during the pandemic. Today, the Mary Cariola Center and URMC announced a $4 million study that will focus on how the virus spreads among vulnerable populations. Allie Peters joins us live in studio now with the impact this could have. Allie.
Jack, this is critical for some families in our area that have students with developmental disabilities or special needs. Not only are many of these students at a greater risk if they catch COVID-19, but there's also a lot less research when it comes to how the virus or vaccine could impact them. This study coming at a critical time with kids back in class. And researchers say students with intellectual or developmental disabilities are 4 times more likely to catch COVID-19.
Then if they do catch it, they're in the region of about 7 to 8 times more likely to succumb to the disease. So that's a 32-fold increase in risk.
The study hoping to keep kids safe while learning more about how the virus impacts those with disabilities. Researchers will also be looking at best testing practices, COVID cases in kids, and how long antibodies last.
In the IDD population, many of the youngsters who have complex medical issues, we don't know how long that's going to last. So it's important for us to track that.
Sarah Tedesco has already enrolled her son Harry in the study. She hopes it will keep him safe after a year of uncertainty.
With his limited ability to communicate, we do worry that if he were to contract the virus, we might not know he was even sick until it was very serious.
But now Harry is one of many kids locally, paving the way when it comes to testing among vulnerable populations. He and other students' results will be used nationally to help schools better understand the virus and how it impacts kids. And experts say this is a big step forward for a population often forgotten about.
It's really important for us to say, don't neglect our children. They are among the most vulnerable and medically fragile kids, and if they get this virus, the outcome is very frightening.
As part of the project, mobile testing units will also be used for students and staff members. Doctors say these units can go directly to a kid's home to test them if they're feeling sick, making sure they know for certain they're healthy before heading to class. Live in studio, Allie Peters, News 8.
Allie, thank you. This $4 million project is being funded by the National Institutes of Health and could take up to 2 years. The data collected at Mary Cariola will merge with data being collected at other sites around the country, helping them to better learn how to handle the pandemic in schools.